Welcome to Potline Bling, the podcast where we talk about cannabis, science, and cool things like that. Today, I have the pleasure of introducing Tim Byars. Tim is the Director of Medical Cannabis Programs at Pacific College in Health and Sciences. Tim is an expert in cannabis science, education, and policy, and he can speak about how each of those aspects relate to phytocannabinoids. Tim, thank you so much for taking the time to join us today.
It's my pleasure. Thanks for having me.
Of course. So let's talk a little bit about what you do over at Pacific College.
Sure. So at Pacific College, we have two programs that are cannabis specific. We have a certificate program that's 8 credits and 3 classes. It takes about 6 months to complete. And we are introducing a master's program in the fall. It's a traditional master's program. It's a master's of science and medical cannabis therapeutics. And it's 10 classes and 30 credits. That would take about 20 months to complete. So both of them are healthcare specific. So, we have specific silos in the cannabis industry, and we like to focus on the healthcare silo. Although the certificate program is also, we have one track that's for non-healthcare professionals. So really any cannabis stakeholder who's interested in learning more about how to use cannabis therapeutically can certainly join the program.
Have you noticed more students interested in working in the cannabis field, or as you said, is this targeted for people in public health or nurses or PAs?
Yeah, we certainly we get a lot of healthcare professionals who are interested, and people who want to who want to add cannabis as an adjunct therapy to their existing practice. And the nursing community is a very important community in our program, and of course they've been early adopters in the cannabis space for a long time. So they're very important to our program. But we also see other healthcare professionals, acupuncturists, massage therapists. A variety of other working healthcare professionals or coaches, people working in the health and human performance space. And then we get people from the industry also, bud tenders who are interested in learning more about cannabis, people who simply have maybe they have a family member or a friend that they're hoping to help who's using cannabis medically.
Yeah, so when I was in school, I had to do rotations in hospitals, and it was something that it was still kind of taboo. Even though I went to University of Colorado, they were really strict on cannabis, even though it was legal there. And I found it kind of like, man, it's so weird. There's so many therapeutic uses for this. To not be even considering it is it has to be due to like an education gap, right? I noticed that or I was reading that you've started a company, or you co-founded a company to help close that cannabis education gap for the medical community. Can you talk a little bit about that?
Yeah, that's a company that we founded in 2018. It's called Radicle Health, and it's an education company that's specifically targeted to help healthcare professionals understand how to use cannabis medicinally. And we've come a long way. I've been in the industry since about 2014, and I've definitely seen that. I think we're at a tipping point now. There is still, I would love to stand here and say that there is no longer a stigma about cannabis and cannabis users, but unfortunately, it's intransigent and it's still here. But I think we've come a long way, and I do think we've hit a tipping point. And so now especially when we get in front of groups of medical professionals, they're very curious and very interested. So I'm hoping that hospital organizations will start to take a more proactive position about learning about the endocannabinoid system, learning about phytocannabinoids. I fear that maybe federal legalization is the remaining obstacle, but I am also cautiously optimistic that we might have some kind of federal reform by the end of 2022.
Let's hope. I would love that. So what's the biggest challenge that you guys have faced when getting healthcare providers to use cannabis and recommend their patients to use cannabis?
Yeah, there's a lot of fear about losing their license. So that's the first thing. We know that, cannabis at the federal level is still a Schedule One drug. So clinicians are very wary of even talking about it. Also, they don't really know much about it. They don't know what products to recommend. They don't know what cannabinoids to recommend. They don't know the dose to start at. They don't know how to titrate that dose. They don't know what the drug-drug interactions are going to be. They don't know what the adverse side effects will be. So they have all of these questions. And, when a patient comes in and says, "Hey, how about cannabis?" They say, "Gosh, I've heard good things about it. But I don't really know anything about it." Go on, go down to the local dispensary and talk to the retail worker there and see what they can tell you, which is not a good model.
Definitely not a good model. I would much rather be given the recommendations by the doctor, and this is where we need people like you and companies like yours to kind of close that gap in education and give them the information they need to be able to guide patients in the right way. But it's still a challenge because there's still there needs to be more studies. We need more science pushing this frontier forward.
Yes. I will say that cannabis is probably the most well-studied drug on the planet. And when we look at the studies that are in the medical literature, I think there are now over 50,000 studies, multiple hundreds of clinical studies. But because there are so many potential uses for cannabinoid medicines, there are disease states for which we don't really have much information. And, a lot of these disease states are ones that have been approved at the state level for cannabis use. And so there's an understandable reticence about, using cannabis for things where there's not a lot of research. But we do know that there is substantial and conclusive evidence about the efficacy and safety of cannabis in specific conditions and disease: chronic pain in adults, nausea and vomiting, spasticity in MS.
Yep.
And then there's good evidence in other conditions and disease as well. We will always need more research, but I think we have plenty of research to understand that cannabis can be a really safe and effective medicine.
I agree with that. I think I'm more talking about like the dosing of it, right? And there are so many different cannabinoids that are now just blowing up in the industry that we there's obviously studies about it, but what about like I hear like THCP, THCV, these more rare ones. There was a study that that came out of Oregon that said CBGA, so the acidic versions of cannabinoids seem to work better for this. And the big question that I always get, coming from a pharmacy background is what is the dose? And I think it's difficult because it's the pharmacokinetics are variable. If you look at people taking edibles, it's kind of different from person to person.
Yeah, that's a good point. When we talk to clinicians and we have these presentations that we give them and we start talking about the science behind the endocannabinoid system, they don't really care. They want to know, what do I give my patient? How much do they give them? How do they titrate it? And, when do they raise the dose and when do they stop taking it? So they want that kind of concrete information that's going to help them treat their patients. And you're right, there are so many cannabinoids, and then we have new cannabinoids that are still being discovered. We have synthetic cannabinoids that are still being created. And then we're all N of one also, right? We all respond a little bit differently to each of these things. And so clearly this is not this modality, this health modality is not something that is easily standardized, right? There's a lot of experimentation when people are coming to cannabis. And I think that's partly why we have some patient populations that don't do so well with it, because they're just not willing to sort of go through that experimental process.
Yeah. So talk to me a little bit about what got you into the whole cannabis industry. I've noticed that you went from tech for a bunch of years to now cannabis.
Yeah, it was in 2014, and my wife and I were sitting out on the back porch having a glass of wine, and we were both working professionals, and not necessarily we were no longer emotionally engaged with our professions, and so we were looking to do something different. And Rebecca had mentioned, she said, why don't we get into the cannabis space?" And I've been a cannabis user for 30 years, and I thought, well, that's an interesting idea. And a very dear friend of ours and my current business partner, Eloise Thiessen, had started a cannabis clinic, and she was treating patients. She's a nurse practitioner, and she was having difficulty finding the right products for her senior community, finding the right companies to deliver those products, finding the right support. So Rebecca and I thought we could step in and do that. We could have a delivery and consulting service. And so we started a company. This was in 2015. And basically, we worked with Eloise's patients, and we would deliver products to them, but also sit down with them and make sure that they understood their treatment plan, make sure they understood their dosing instructions. Sometimes they needed help learning how to use the devices. These were seniors who were, trying to use a vape pen for the first time. Sometimes even, the act of inhaling is not necessarily intuitive. So we had to teach, these patients how to inhale cannabis. And then we would offer ongoing support and products. And we did that for 3 years, but then California passed Prop 64, which allowed adult use. And one of the other things that proposition did is it enabled municipalities to unilaterally ban commercial cannabis, and that's what most counties did. Obviously, San Francisco and Oakland and LA, those areas had lots of cannabis access, but most of the state, most of the companies either had to go into the gray market or illicit market or shut down. And so that's what we did. We shut down. And then we pivoted. That's when we founded Radicle Health and just started focusing on education. During that time, I was still doing some curriculum development. So my background isn't tech, but it's in instructional systems design, curriculum development, information architecture. So I was still doing some curriculum design for some companies and colleges, and that's when I designed a class for Pacific College for the initial certificate program, and then they brought me on to teach the class. And so I was on faculty for a little while, and then in January I accepted the directorship.
Oh, that's awesome. How are you liking that now?
Oh, it's fantastic. I get to talk about cannabis all day.
That's great. So what are your thoughts on, you mentioned that we might have some kind of reform coming up soon. I feel like every time, there's elections or something coming up, I hear this chatter. What are your thoughts? Where do you think this is going? Who do you think is finally going to legalize this? Let's go there.
Well, we're in August, so I was a lot more hopeful in January. So my thoughts are, so we're approaching the end of the legislative cycle. So anything that doesn't, navigate the legislative process by the end of December is pretty much dead. We do know that the Administration and Opportunity Act was introduced into the Senate, and there's some support for that. I don't know if there's comprehensive support for it. It's very similar to the MORE Act, which already passed in the House. So I think that there is a chance that that may pass. I think more probably something that's less comprehensive has a chance of passing, something like the Safe Banking Act, especially if it gets tucked into another bill. I think, in fact, I think something similar to the Safe Banking Act was tucked into a defense spending bill at some point. So I can see decriminalization happening, just mostly because it sort of frees up banks and financial institutions to start working with the cannabis industry. There's also, Nancy Mace has an act that she introduced, and she's a Republican, and Republicans seem to have an easier time lining up behind their own bills than Democrats do, and so and her bill is it's very sparse. There are really very few, if any, federal programs that are designed to help the communities that have been disproportionately impacted by the war on drugs. The taxes are much lower in Mesa's bill. So I can see maybe the industry getting behind that. I can definitely see anyone on the Republican side of the aisle, libertarians getting behind that act more so than something like the Cannabis Administration and Opportunity Act. Or maybe nothing happens. How disappointing would it be if something actually did pass and Joe Biden vetoed it? He's not exactly been a proponent of. He's not a drug advocate, certainly.
Yeah.
But hopefully we'll get something passed this year, because otherwise, if the Senate changes, and there's a Republican majority, we didn't see any cannabis legislation when the Republicans had control of the Senate. So I'm worried that if something doesn't happen this year, we might have another couple of years to wait.
So I think I have a lot of friends in the industry. I've seen what's going on in California and Colorado right now, and it's tough out there. They're not making money. It's I see a lot of them going out of business. It's pretty sad, and we definitely need some kind of reform. We need some help. I myself have a cannabis business. I've been booted out of banks multiple times. I have over 100 employees that I've had to sometimes pay out of pocket because the bank shut me down. And it's at this point, I feel like the majority of Americans use cannabis in some way, shape, or form, whether it's CBD, CBG, your Delta 9, your Delta 8, it's everywhere now.
Yeah, it certainly is. And we need to regulate it. I think everyone can see, well, most people have to see that. I think it's a matter of how do we move forward with it. I always hear people talk about the green rush, and I'm like, what, man, I wish that would rush over in my direction, because I don't really know anyone who's making money hand over fist in the industry. Certainly there is a lot of money in the industry, but I think for most people who are boots on the ground and running companies, it's a struggle. And even companies that aren't plant touching, like it took my company, an education company, 6 months to get a bank account. I had to sit down with a small local bank with the CEO and the CFO and tell them specifically what we were doing, specifically where the income was coming from, before they would agree. And then we had, a couple of point of sale companies close our accounts, or we couldn't even get I think it's Square. No, we have a Square account right now. There's another point of sale that's headquartered in San Francisco. And which one?
Is it Stripe?
Yeah, Stripe. They're headquartered in San Francisco, where we've had legal cannabis since 1996, and they wouldn't even consider us, which was really important. Really disappointing. So we got to solve that problem first and foremost. We can't. We also have to stop putting people in jail for cannabis use. There's a lot of chatter in the industry about, well, we shouldn't have passed this, or we shouldn't have passed that. I get it. I understand how, people have been in the industry for a long time, and, cultivators who have been working for generations, and how they're being excluded from the legal cannabis industry. I get all of that. But from my perspective, we have to stop incarcerating people. And the only way to do that is to pass these laws, and then figure out how to fix it.
Yeah, I see people going crazy over Brittany Griner getting incarcerated for having a vape pen, and there's all this outrage, and I'm like, guys, this has been happening in the States forever. We need to change. I mean, we're incarcerating people still till this day for cannabis, something that you can get in pretty much every state at this point. We need to change. We need to change.
Yeah, we definitely do. And even legislation at the federal level won't completely stop it. I mean, we still have 3 states where cannabis is completely illegal in all forms. So, we shouldn't have medicine by zip code, right? Either something has therapeutic value and it's available to patients and consumers, or it doesn't. And clearly cannabis does. I mean, there's a mountain of evidence to demonstrate that it has, in many cases, it's more safe, it's more effective than many prescription medications that we use. So we have to address that at the federal level, and then we have to get those last three states on board also.
Agreed. So what in the years that you've been doing this, what do you think has, I wouldn't say the most therapeutic value, but which cannabinoid which cannabinoid do you think is going to be the most widely accepted right now in the medical community?
Well, not THC. It's got too much baggage, which is unfortunate because I think the medicinal value of THC is, it's a very useful cannabinoid. And I should, I need to note that I'm not a clinician. I'm not a doctor. I'm not a healthcare professional. But I see patients using a number of different cannabinoids. Like, I love the acidic cannabinoids, right? You can use acidic cannabinoids throughout the day. If you got to go to work or if you have to go to school, they're non-impairing. Obviously CBD is a great cannabinoid at multiple therapeutic uses. I'm a little reticent about Delta 8. You mentioned Delta 8 earlier, only because of the way that it's, the way that it's made, and most products that have Delta 8, I consider it a synthetic cannabinoid, even though it's naturally occurring. I don't think many companies or products have naturally occurring Delta 8. So I worry about the byproducts in those products. But if we are able to get a very clean Delta 8 product, I think that's great also, because it's a little bit less psychoactive than Delta 9. And again, we can have these therapeutic uses without impairment. And I love the euphoria of THC. I think there's a time and a place for it. But many of us have to go to work during the day, or have to go to school, or have to drive a car. And so having these other cannabinoids that are non-impairing, I think it's probably the future of cannabis.
Yeah, I see cannabis non-psychoactives being used on a daily basis. We but we do need some change. I think the whole thing about Delta 8 is really we need regulation. We need regulators to come in and tell us what we can't do. Testing is a nightmare right now from experience. I get wildly different test results. We have done GC mass specs on what we've done, but again, regulation is needed. Taxation is needed. We need to be able to bank. We need to be able to just conduct our business and push the industry forward.
Yeah, it's crazy that we have a hemp industry that's completely unregulated in terms of medical products, and a cannabis industry that's regulated to a burdensome extent. And we're producing the same cannabinoids largely out of these two industries. So yeah, we need to sort of just have an umbrella. I do hope that it's not over regulated. I know that even in like in a state like California, when states roll out initial regulations, often what happens is that they have these really high taxes, these really high barriers of access to the industry, the lack of access for consumers. And so all of that does is it supports the illicit industry. And it doesn't give entrepreneurs and patients an opportunity to engage in the legal market. So we really need to be, states need to be smart about how they roll out their medical and adult use programs. And that starts with taxing. If you have burdensome taxes on legal products, then people are going to continue getting it from the illicit market where they've been getting it for decades and decades.
Yep. I couldn't agree more. So, Tim, we got to wrap it up. Listeners, if you want to learn more about the programs over at Pacific College, go to pacificcollege.edu. Tim, thank you so much for taking the time to join us today on this podcast. Thank you all, guys, for listening. You can find all our episodes on cannabisradio.com. Please rate the show, like, subscribe. You can listen to this podcast anywhere where you listen to podcasts: Apple Podcasts, Spotify, iHeartRadio, Amazon, Google, whatever you guys want. We'll talk to you next time. Thank you so much, guys.